Hi everyone, this is the first episode of our podcast series. Today we are here with Dr. Cüneyt Kayaalp. Welcome, how are you?
Thank you so much. I thank you for your nice invitation. I hope it will be a good podcast for everybody.
Yeah, I'm sure it will be. So let's start with your career. Studying medicine is so much effortful and it's known to be very hard to graduate. And considering your specialty, you are a general surgeon, right?
Yes.
Considering your specialty, it must have taken so much time.
Yes, I agree with you. It's a long way. Education in medicine takes a long time. At first, you have to finish a medical school. I was graduated in Hacettepe Medical Faculty. It was one of the leader universities, medical faculties in Turkey. And it's also one of the best medical schools also in Europe. And after this education, I went on to general surgery residency. And in Ankara, in capital, I worked. And after that, 4 years after this residency, I worked on as a gastrointestinal surgery, as a subspecialty, which is very important issue in under the general surgery fellowship. And for 2 years, I worked as a gastrointestinal surgery fellowship. And after that, I became a GI surgeon. And as a GI surgeon, I have 3 topics. One of them is bariatric surgery. Bariatric surgery, in other words, is a weight loss surgery. And the other topic is cancer surgery. And the last one is organ transplantation, including liver, kidney, and pancreatic transplantation. But nowadays, particularly bariatric surgery is very common in my practice. And there are lots of patients coming from all around the world for surgeries to Turkey, particularly to Istanbul.
That was a great entry to our podcast. Thank you. So let's talk more about your specialty and your branch. You said
gastrointestinal surgery.
Can you elaborate on that?
Yes, sure. I work only in the digestive system surgery. As a digestive system, there are lots of diseases, of course, but some of them include only medical treatment, and some of them include some surgical requirements. And I only use the surgical practice. For example, if you have a gastritis or a irritable bowel syndrome, they're all the medical part of this digestive disease. These are apart from my specialty, from my branch. But in surgical part, for example, if there is a colon cancer or gastric cancer or a liver tumor or a bariatric surgery, they are all my topic, and I work only on these topics. In general surgery, of course, there are some other organs and diseases we can treat, but I never do them. For example, a breast cancer or a thyroid diseases. As a general surgeon, we can do it, but after my specialization, after my subspecialization, I never do them. I only work on gastrointestinal digestive disease surgeries. In the world, there are lots of surgical procedures, but there are 4 standard surgical procedures that were accepted from the international societies. For example, in International Federation of Surgical Obesity, IFSO, I'm one of this society, accepts only 4 surgeries. One of them is banding, and the second one, sleeve gastrectomy, and the third one is a gastric bypass, and the fourth one is mini gastric bypass. And of course, there are lots of other emerging techniques and new techniques, and but in these new techniques, we don't know the outcomes in the long term. So sometimes patients require these new techniques to perform themselves. But I always tell them, of course we can do all these new surgical techniques, but I cannot give any guarantee for 5 years or 10 years after what we don't know the results and outcomes. So I suggest the patients to prefer the standard procedures until the evidence-based medicine accepts the new techniques and emerging techniques. So we can say that band, mini gastric bypass, rheumatoid gastric bypass, and sleeve gastrectomy are standard procedures.
So can we consider these operations as a last resort for the patients? I mean, the last thing to do after diets or exercises or other potential ways for weight loss. I want to ask you about the post-operative phases of bariatric operations. Let's say a patient have undergone a procedure, a gastric sleeve or gastric bypass. Is this an absolute solution, or the patient should always be careful about their lifestyles?
Of course, losing weight is not a stomach-originated problem. It's a mental problem, actually. The patient should change their habits, eating habits, and lifestyle. And we, of course, do some surgical procedures in the stomach and sometimes as well in the intestine. But in a short period of time after these surgeries, they are losing weight. And sometimes, unfortunately, if they do not change their habits, eating habits and lifestyle, they gain weight again. In order to protect weight regaining, they have to change their mind. At the beginning of the post-operative period, they stay in the hospital for 3 days, and after that, I always say that you have to be keeping contact with me, because the golden time of the surgery is in the first 3 months. In these 90 days, in average 100 days, they are losing the maximum weight. So they have to change their eating habits and also lifestyle during these 100 days. And in order to help these people, they have to contact with a professional. And this professional, of course, should be their surgeon. Mm-hmm. So it's very important. And every week, I want their list of eating and sporting activities. Mm-hmm. All of my patients send me the weekly activities and eating lists for 100 days. I think it's very paramount to change their new life and to get the better and healthy habits after surgery. So it's not only a cutting a stomach.
Mm-hmm. I'm very curious about are these operations, can they be applied again to the same patients?
Yes, they can
for
be
the
done.
Second time or third time?
Yes, they can be done. But actually, we don't want to do them. But
is it more risky?
Of course, it's more risky. And also, the best thing is the first one. If they lose weight after surgery and keep the weight in a standard, on a stable state, it's the best. But if they gain weight again, of course, we can do another surgery. But the gaining weight can be originated from 2 causes. First, the first reason there can be a technical problem in the first surgery. For example, there can be a large stomach, or there can be a large connection between the stomach and intestine, or etc. In short, maybe there is a technical problem in the surgical procedure. And the second one is the worst one, mental problems. Because despite the most effective surgeries, people can gain weight again. If they eat continuously in every time, it's very difficult to treat these people with a surgery. In these issues, we can say that for a repeated surgery, before surgery, we have to check the stomach with endoscopy and also with a contrast enhanced computed tomography. And in order to these interventions, we are trying to understand, was there any technical problem or not? If there is a technical problem, of course, we have to revisit. But if there is no problem, if the surgical procedure is perfect, there is no problem, then at first, before a second surgery, we have to send the patient for the psychiatric or other departments for support. And after that, maybe we can do another surgery.
Is this a legal procedure or what the doctors prefer to do?
No, it's the standard procedure from the societies. They suggest this because if there is no technical problem for the surgical procedure, of course, the reason for weight regain should be the excess food eating. That's why, in order to control this, they suggest that please send the patient to the psychiatrist. If they do not change this, a second surgery will not help her.
I have one other questions about this topic. Is the psychiatry check also necessary before the first operation?
Yes, it's also necessary because if the patient has a severe mental problems such as schizophrenia or other psychiatric diseases, of course, we have to stop the surgery and do other things.
I want to know more about the differences between these operations, between gastric sleeve and gastric bypass, or mini gastric bypass, right?
Right.
Can you elaborate on that?
Yes, sure. Sleeve gastrectomy was performed only in the stomach. And bypass procedures, both of them, are a connection of the stomach and intestinal surgery. And bypass is a short way, and food bypasses to the duodenum, and it passes from the small stomach directly to the intestine. That's why it's called as bypass. But sleeve gastrectomy was performed only in the stomach. The stomach becomes like a banana, a small one. And the outcomes are, of course, different because sleeve gastrectomy is a restrictive procedure.
Restrictive?
Restrictive means you create a small stomach. And bypass procedures is a restrictive, a small stomach connected with a bypass. That means it's a restrictive and malabsorptive. So if people can eat something, it's not absorbed completely. For example, only 80% of the food absorbed from the intestine. Because of the bypass, for example, 20% is bypassed and not absorbed from the intestine. That means it's a supportive, additional power for losing weight. So bypass procedures cause more weight loss than sleeve gastrectomy. And but sleeve gastrectomy is very popular. It's very good surgery and safe surgery because you do only stomach surgery. It's safe. And in the world and also in Turkey, almost maybe 75% of the people requires only a sleeve gastrectomy. And I agree with this policy. It should be the first line surgical procedure for the bariatric surgery. But sometimes you can prefer the other procedures as a first line procedure. For example, if the patient has a diabetes or a severe comorbidities like hypertension or high cholesterol levels, at that time you can prefer gastric bypasses. Also, if the patient has a severe reflux, you mean, if the gastric content goes back to the esophagus, it causes some burning heart. At that time, a sleeve gastrectomy can exacerbate these symptoms. That's why sometimes in these cases we prefer a bypass. So in a short, we can say that most people are suitable for sleeve gastrectomy, and in selected patients, we can say that gastric bypass can be performed.
There's one more thing I want to ask you. Can you tell us about international technical standards, if there are any, in this bariatric operations, and where is Turkey's standpoint in this matter?
These procedures, particularly bariatric surgery, is performed by laparoscopic surgery. Laparoscopic surgery, in other words, keyhole surgery. Keyhole surgery, keyhole or laparoscopy. We do not open the abdomen. We all do the procedures from the holes we perform to the abdomen. And in these procedures, we have to see the inside, and we have to do the procedures without touching the organs. And in these procedures, we have to use the technology. So we cannot see the inside of the abdomen with our eyes. So we use cameras, we use graspers, scissors, or something else from outside the abdomen. So this requires a technology. And you cannot see, if you cannot see the surgical area very well, of course you cannot do the high quality surgery. So it depends on your visibility. If you see better, you do better. So technological background or technological equipment is very, very important. In Turkey, hopefully, in almost 90% of the hospitals who do bariatric surgery have very well equipped, and they are all use very new technologies, because there are lots of patients are coming from all over the world, also in Turkey. So because of the very high patient volume, we have to keep all the technology in a high level. So in Turkey, there is no problem about this. And also the hospital facilities are important. For example, the interventional radiology, anesthesiology, nursery, these are all very good, and they should be good. Otherwise, there will be a problem. So it's a teamwork. And in Turkey, bariatric surgery and all other procedures can be performed under very good conditions, very high quality, and very good results. That's why lots of people are coming here. They are getting very high quality work and with a better prices, of course.
Yeah.
That's why they are coming here.
Yeah, that's important. These were all my questions. Thank you so much for meeting with us today. Thank you for your time. I learned so much today. I hope our viewers and listeners did too.
Thank you so much.